All right, the CDC has confirmed hundreds of cases of heart inflammation in patients under 30 after receiving the COVID-19 vaccine, but has yet to give any guidance because this happens. In fact, they don't even want to talk about it. Our next guest's son was a healthy 17-year-old set to play college soccer starting in 3 months when he received his first Pfizer vaccine on June 15th. Exactly a week later, he began experiencing chest pain and was ultimately diagnosed with 2 conditions related to heart inflammation. Here with more on his family's experience, Fabio Bellingieri, along with Fox News medical contributor Dr. Nicole Saphier. Dr. Saphier, I just want Fabio to talk about his son, what he went through, and then have you jump in and tell me what you think. Fabio, great to see you. We do know each other through soccer circles, and you have soccer players in your family, and you hear that the school's making your college soccer players, everyone's going to get vaccinated. You guys had the virus already, and everyone's okay, except your 17-year-old. Can you tell us what happened?
Yeah, he was required to get the vaccine for school. So, you know, with time running out, we kind of waited, and we had his first vaccine on June 15th. And I never thought anything of it. You know, everything is low risk. Everybody said it's fine. I kind of knew about the condition, and then a week later, I came home, and he started telling me that his heart was hurting him every time he had a heartbeat. And I thought maybe it was a pulled muscle, just being an athlete. I said, does it hurt when you move? Does it hurt when you breathe? He's like, no, it just hurts every time my heart beats. So I took him to the clinic, the walk-in clinic. I said, let me just get it checked out. They did an EKG. Everything looked great. They said, let's go look at the cardiologist tomorrow just to get it checked out. They did the sonogram. It looked great. And then they did blood work. They said, let's just check out the blood, make sure everything's good. The lady said it'll be 2-3 days before you get the result. Next thing I know, next day, I get a call like, this bad news. Your son has to get to the emergency room right away. I'm like, today is his prom. Can he go later? They're like, no, he can't go to his prom. He needs to go to the hospital. His troponin levels were off the chart. What they told me was normal was like 40. He had like 9,000. So, you know, they rushed him in. They, you know, did all the, just checked out, make sure he's all fine. And was there for a couple of days, missed his prom, barely made his graduation because they were pushing for him to get out if his levels, his troponin numbers went down, which they did, but still high. And now he's had a heart condition, and he can't, you know, he can't do all the things he loves to do. He can't go surfing. He just got a surfboard for the summer. He can't hang out with his friends and do, you know, things that 17-year-olds do. And the biggest part, he can't play soccer in the fall, which broke his heart and my heart. So that's about where we are now.
And he still has some scar tissue, right? There's lasting damage?
Yeah, we went to the cardio last week. He's continuing to have tests and EKGs. His EKG was a little off. What happens, I guess, is oxygen doesn't get in those areas, so it has to heal. So he has to be very careful that he doesn't do anything strenuous, so his heart rate doesn't, you know, increase, and he can have there's always a danger of a heart attack. So of course, as a parent, you're super concerned every time he goes out with his friends that even though we told him, please don't do anything, you know, you always fear that.
Dr. Saphier, have you heard stories like this before? What are your questions for Fabio?
Well, sure, Brian, and I can tell you it's really hard to tell a 17-year-old boy that he can't go out and do any sort of strenuous exercises, and it's devastating that he missed his prom because of this. You know, Brian and Fabio, what you see from the New York Times, even to the CDC, ACIP, the way that they're presenting the data regarding adverse effects from the vaccines in adolescents is really irresponsible in the sense that they kind of cherry-pick the way that they present the data. It's an all-or-none approach. They say either adolescents are fully vaccinated with 2 doses or every single one of them is going to get COVID-19. And that's the way that they're balancing right now. But I don't think that's the right way to be doing it, because what you have to look at are what are the potential adverse effects from the vaccines, such as myocarditis, inflammation of the house, and then balance that with the fact that not every single adolescent is going to get infected with this virus, especially when you're in many areas of the country where case transmission is exceedingly low. They are not looking at decreasing the dose for adolescents, perhaps giving them just a single dose, or maybe even just giving it to select people who are at a higher risk for severe outcomes from COVID-19.
And Dr. Saphier, he had it already.
When it comes
he had the virus. He had the natural immunity.
They have some sort of Well, and unfortunately, they still continue to deny natural immunity having a robust protection. And the truth is, it does. We have just as much data showing natural immunity having a strong protective effects as we do the vaccines.
Exactly.
But they continue to stop and not acknowledge it. And Fabio, for himself, his entire family likely still had positive antibodies. He likely didn't need the vaccine right now. And here he is, not even able to play soccer because he got the vaccine for soccer. It's irresponsible. It doesn't make sense. And the FDA needs to look a little bit closer at these vaccines before they continue having universal recommendations.
Absolutely. And Fabio, I guess they still want you to take the second shot, right?
The school requires it. I have to get a medical note saying that he can't, but I from what I read, the CDC requires it after he gets healthy enough. So, which
Gotcha.
I'm pretty sure I'm not going to do. I mean, I have my other son that wants to play soccer and go to a SUNY school also, and he hasn't had the shot, and of course I'm
worried
very
about it.
hesitant to. Yes,
Fabio,
not worried.
you will stay up with this. We hope you guys get back better, and maybe it's just the fall, and you use that eligibility for 4 more years. Thanks so much for joining us, Dr. Saphier. Thanks so much, too.